Hi, everybody out there on the internet. I'm Voluntary. I'm the chair of the Oakland County Democratic Party, and we're bringing you another one of our conversations we've been doing with some of our friends, some of our elected officials, to kind of keep everybody up to date on what's going on around the county as we're all dealing with this COVID-19 crisis. To ask you is right off the top, if you want to stay up to date on the different interviews that we have and that we're doing, make sure that you're seeing them as they come out. Make sure that you are signed up for our email list through ocdp.org. Make sure you're following us on Facebook. You can also follow us on Twitter, and we have our YouTube channel now, and everything's going to be hitting us. We're trying to bring you these interviews as fast as we can and talk to as many people as possible, so we're giving you the most accurate, up-to-date information about what's happening in your county. So today we're going to be talking to Oakland County Executive Dave Coulter. Right. Dave, how are you doing? Like I always like to start with, how are you? How is your family? How are you dealing with this crisis?
Well, hi, Vaughn, and thanks for having me. And I appreciate you starting with that. I'm doing fine. I'm healthy. I'm getting enough rest, which is the secret for me. These days can be very long, but I find that a good night's sleep cures a lot of things. And my family, my immediate family, is doing well as well. Of course, I have friends and colleagues and others who are not doing as well, but I'm happy to say that at least my immediate family, we're doing well. We're doing what we're told, and we're managing well. Thank you.
Great. So the main question that I wanted to ask, and something that I've been thinking about since this really started, is what are the biggest challenges that the county government have been facing as we've been dealing with this crisis? What's, for somebody that kind of came into this job really quickly and didn't, I don't think, really expect to be in this situation, what are the biggest challenges? What are the biggest learning opportunities or things that you've had to deal with really quickly that you've been facing as we've been moving through this crisis over the last month?
Yeah, I mean, and that's a great point. Nobody expects to be governing during a pandemic. We haven't had one like this in 100 years. So everything is new in that regard. But, I had been a mayor for 9 years. I'd been on the county commission before that for 8 years, especially on my time on the county commission. I knew that we had a great public health department. And I knew when I took this job that the public health department reported to me. But it has been very satisfying to really get to work with the folks in public health on a daily basis and understand just how professional and smart and dedicated these folks are. I think, and we've seen this, at the federal level with Dr. Fauci and at the state level with Dr. Genet. But these are people, these are heroes to me now, and they kind of had gone unnoticed before this. But I can assure Oakland County residents that we have an amazing public health department. And even though this virus is new and the way we have to react to it is different, they've been doing this. This is what they're trained to do. About a year ago, we had a measles outbreak in Oakland County, and they were all over that, right? And they identified where it was, and they did the contacts to people who could be exposed, and they were. And so they told me, look, this virus is new, but this is what we do. And so trust us. And it is good to have medical and scientific people who understand this. And I will tell you, as a public official, I defer to them in terms of their expertise on what's happening from a scientific and a medical perspective. And they give me great confidence every day that they're not politicians. They're not looking at this from a political perspective, but they're just trying to keep Oakland County residents safe. And I've learned to really lean on them, push them. They push me. And I've learned a lot more about public health than I ever have in the past. Now, coupled with that, this is both, and this is the challenge of this epidemic, right? Or this pandemic, really, is that it's both a public health crisis, but at the same time, it's an economic crisis. And so I've been working just as closely with our economic development people. And some of that isn't as public, because the public facing of this up till now has been the public health aspect of this and what we all need to do to keep ourselves safe, keep our family and our loved ones safe, and how not to spread this virus and how not to get it in the first place. But the public should also know, and we're going to be talking about this more and more in the days to come, that we're also planning on when the governor lifts the stay-at-home order and when we are allowed to do more economic activity and more social activity, that's going to look very differently as well. And so working on sort of both of those simultaneously has been an incredible challenge. But mostly I just feel just a responsibility and a gratefulness that I'm here and that I get to do this work. I think anybody that's in public service will tell you that this is what we signed up for. Not a pandemic necessarily, but we're here to serve. And we have a passion for helping our communities, helping the people that help put us in these positions. And it's quite an honor to be here at this very important time and to be able to do this work. And so I'm thankful to be here, and I'm thankful for the people that work at Oakland County and throughout the county at the organizations and the hospitals and the nonprofits that are doing this work. And it's really a privilege to be able to get to lead this team.
Well, yeah, and I definitely think this is one thing that I would hope that comes out of this crisis is hopefully an appreciation that all of us will have for, experts. That, we have this sort of weirdly unearned sense of invincibility as people in America, because so much has been done behind the scenes to make it so that we're able to have these lives of relative comfort and affluence. And I'm hopeful that one of the things that people will start to really appreciate is that, talking about the experts in the Oakland County Health Department, that there are people that work their entire lives to prepare for this moment. And right now, they are the first line of defense for all of us against the, further outbreaks. And to a certain extent, it's just put more of this front and center. But I wanted to go back and talk about something that you mentioned that I'm kind of curious about, which is when we get, so they all clear from the governor's office and start talking about the procedure of reopening the economy. How difficult do you feel it's going to be to sort of manage that reopening? Because, I'm going to speak from personal experience. My kids, I have 3 kids, and they're heartbroken that they can't see their friends. So I know that the first day that the governor says, like, everybody's all clear, everything's going to be doing, they're going to want to have like a giant sleepover with all their people. But we're not really even close to a point where we are really all clear. So how hard do you think it's going to be to manage that, not just on the personal level, but when you talk about the economic level? There are lots of business owners. I used to be a small business owner. And if I was still a small business owner right now, I'd be thinking, what's the first day that I can open my doors? What's the first day I can let people back in? How do you think how are you looking forward to managing that challenge?
It's going to be challenging. And the first thing we're going to have to manage is people's expectations, because just like you said, we all want a magic date to appear and everything goes back to normal. And frankly, it's not going to be normal for a long time. And so the reopening is going to happen in phases. We're going to reopen a piece. There'll be some additional businesses that get to reopen. There'll be some additional activities that get to reopen, but it's going to be in phases. And a critical part of that is going to be how much testing we do. We're going to need to know who's positive, who is negative, because the businesses, there'll be another round of businesses. This would be my guess. There'll be another round of businesses that are allowed to open, but you'll have to open under different public health protocols. This is one of the reasons why in Oakland County, we've actually gone beyond what the governor has done in a couple of ways. So for those essential businesses that are open, we ask you to check in on your employees and make sure they don't have symptoms, take their temperature if they can. We've now ordered that they wear masks. So we will be reopening the economy, but with precautions, public health precautions. masks and the like. I think we're going to be getting used to wearing masks for a while. Those aren't going away. So we're going to have to ramp up the testing to make sure we know who is positive so that we can help get them the resources that they need, that we can isolate them, that we can make sure that the people who do interface with the public are not positive, so that we have a better assurance and confidence of that. And that's going to require a whole lot more testing than we're doing today. We have a very limited amount of testing right now. You can't get tested in Oakland County or across the country unless you have symptoms. But one of the things we've learned with this virus is that asymptomatic people can be positive and spreading it. So we're gonna need a lot more testing, for instance. So I think it's going to be a gradual reopening where some industries are going to be allowed to work, and then eventually some other industries. But when you talk about large gatherings, for instance, we all want to get back to the days where we can have, big family picnics and maybe even go to a ball game. I really think that large gatherings are a ways off. And I think we're going to have to be, as public officials, we're going to have to help manage those expectations. You hear about this with sports leagues, for instance. You're not going to be going to a Tigers game anytime soon.
Hold on. Do not break my heart like that, because I cannot take it, okay?
But I know. Worse than that, because I'm a big Michigan State fan, and I can't wait to go back to Spartan Stadium, and that's not supposed to happen until September. I think there's a decent chance that Spartan Stadium isn't going to be able to allow fans in September. That's what I'm talking about. Why? Is it because the governor's being mean, or because we're being overly cautious? No, because we have to know if people going into that stadium, if they have symptoms, if they're positive. And so we have to have the testing and the capability to test that before we can allow. Because here's the other thing I've learned, and our public health director, Kathy Forsley, who's an amazing woman, and she's doing great things. She's told me this from day one. Just understand, pandemics usually go in waves. And so we have to be preparing not only for the wave that we're in, but to try to mitigate another wave from happening. So if you reopen too many things too soon, you make yourself susceptible to another wave. And I think as hard as this has been on individuals and on our businesses, what would be even harder is if we reopen too soon and another wave hits, and then we have to shut down for a second time. So that's literally what we're up against. So I think you're going to be seeing not a day where everybody goes, hallelujah, we're back to normal, but a gradual reopening of our economy and our society that includes things like testing and protocols and masks and distancing for a ways to come. And we just have to get our heads around that. And again, it's not because everybody is anxious to get back to work and get back to normal, but we have to do this in a way that follows the science. And we're going to have to let the smart public health people and the medical people help us dictate when it's safe to do this, so that we don't have a second wave and we don't have to go through this again in a couple of months.
So I'm going to ask a question that's a little bit more maybe challenging and difficult, because I don't think we have a really good answer for it at all. But we're recording on the 16th, and just yesterday there was that large rally in Lansing for people that Operation Gridlock, that really went out really just to kind of protest the governor in general, not sort of this specifically. But what I want to ask, kind of coming away from that, is how do we get buy-in from people who still want to believe that this is somehow really not that bad, or it's not that dangerous? I mean, if you've been looking at the comments on our Facebook post talking about this interview, a lot of this has been people who are, they want to use this as a springboard to talk about how they think this is about their constitutional rights. And how do we talk to those people and kind of understand where they're coming from, and then get them to understand that this is not about politics? It's not, there's no secret agenda here. This is what the science says. I mean, how are you tackling that?
I'm worried about that, because we did a really good job, I think, in March of we were all saying, we're in this together. And I felt like people meant it. but it is getting politicized now, and that's really disappointing because this isn't political. It certainly isn't to me, and I don't think it is to most people. And I'm disappointed that, the Senate Majority Leader came out and said some pretty, discouraging things and some pretty political things, and that's helping to fuel what we saw in Lansing, which felt a lot less about health protocols and a lot more like a Trump rally, and people using this as an opportunity to talk about other issues. That will make it more challenging to get through. It really will. I'm trying to understand their fear, and I will tell you this much I will say, 6 weeks ago, it didn't feel as real to me either here in Oakland County. Before the positive cases start happening and before the deaths start happening, there is a tendency, and you started by saying this at the beginning, to say, this is a problem in China. This is a problem in Italy. We do have this mentality that somehow we're different in America, that we're better protected. But when you're in Oakland County and now you are in a hot spot in this country and you're watching the numbers pile up and the deaths pile up, it hits you in a way that it doesn't if maybe you live in the UP and maybe there are just a few cases in your county. But one of the things I have learned being in Oakland County is that this virus is really tough. It's deadly, and it can happen anywhere. It can happen very quickly, and it can spread really quickly. And so nobody wants to give up their freedoms and their liberties. But the huge concern for us here in Oakland County, and I think needs to be a concern across the state, which is why I don't think the governor should do just an order for Southeast Michigan and something different for the rest, is it can happen really quickly. And the danger is not just that people can get it and die. And of course, obviously, that's a huge concern. But the second thing you really have to be mindful of is that it can very quickly overrun your healthcare system. And that's what we were facing here. Very quickly, our healthcare system, and we have one of the best in the state in terms of the amount of hospitals. We have almost 20 hospitals in Oakland County, and they were overwhelmed. If you look at Traverse City or in Rogers City or in Marquette, where they have one main hospital, the danger, besides, again, people getting it and dying, is that their healthcare system will quickly become overwhelmed. And so, I want to say to those folks, look, this isn't about your liberties. And everybody of any political persuasion wants to get through this as quick as reasonably possible. We all love our freedoms and we all love our country, but we have to do this in a way that doesn't overwhelm our health systems. And you don't want travel restrictions lifted, for instance, the stay home orders lifted, and have folks that are in these hot spots in Wayne, Oakland, and Macomb County traveling up to their second homes up north, or going up to the hotels and motels up north and bringing this with them. And again, because you can be asymptomatic and have it, you don't even know that you have it. And now you're bringing it up north. And now, Traverse City becomes the next hot spot. And we've overwhelmed the healthcare system up there. So I know it's difficult. Sometimes it's hard to, if you're not in the middle of it, to understand what this is about. But politicizing it will only cause more deaths. I worry about the people that went to that rally yesterday and are now going back to their homes and their communities and have perhaps contracted it because they weren't practicing social distancing. They weren't wearing masks. And that's just going to make it worse on the entire state.
Yeah, it's definitely something I worry about. My parents are up near the Gladwin area. And so I'm relatively familiar with the area. I go up to visit them all the time. And they have one hospital in Gladwin, and that's it. So if there's an outbreak there, they just don't have the capacity to handle anything more. And I really feel I saw a thing on the internet a few weeks ago. I think it was out of Italy, and it was talking about how there are two kinds of people that are experiencing this disease. There's the people that are sitting there thinking, man, it's not that bad. Everything's okay. We're going to be fine. We'll just ride it out. And then there's the people that say, man, I wish we had taken this seriously several weeks earlier than we did, because, essentially this is just, it's physics. It's just, it really is. The way that the virus is communicated, or the way that it transfers, it really is. It's just physics. So I have a question here. This is a question that I just got over Messenger, and it's about talking about best practices, right? We are still we're trying to communicate best practices for health protocol for the businesses that are open still right now, but there's varying levels of safety for the different businesses. So how is the county government trying to communicate to the businesses that are operating in Oakland County, whether that's restaurants, grocery stores, any of the essential businesses? How are you communicating to them what they should be doing and what they need to be doing to make sure that they're staying safe, that their employees are safe, and that their customers are safe?
Yeah. So we've literally created a toolkit for our businesses, and we are out there personally delivering them. We already have a great relationship with them anyway. Think about it. The public health department already does health inspections in the restaurants, in the grocery stores. We know who these businesses are that are essential and that are open, pharmacies and the like. And so we've communicated with them directly about what the health orders are, what it means to do this. We've given them our best guidance on how to follow these orders, and we're literally going out there, sending our staff out to these businesses, delivering these health order kits. And in some cases, they include masks if their employees need to be wearing masks. Right now, if in Oakland County, if you're an essential business that's open and you interface with the public, your employees need to be wearing a mask. If you can't get those, we'll help you find those. But we have really great relationships. And this is where we also rely on our economic development people, because they have relationships with the businesses in Oakland County as well that might not be restaurants and pharmacies and that sort of stuff that our health department would. And so our nursing homes, by the way, let me talk about them, because this is really hitting our older members really hard. And so we're out every day testing people in the nursing homes, working with the nursing home operators to make sure they know what the protocols are, how to isolate people that are positive. So we have a very robust and active engagement with our essential businesses. But as that gets expanded and the number of those businesses expand, we'll continue to get them good information, but it may be a phone call instead of a personal visit.
Great. So again, as somebody that used to be a small business owner, one of the things that I worry about a lot is the effect this is having on the workers.
Yeah.
For people that are working these jobs, what kind of support is there for them? If this is something, if you're being told that you're an essential employee and you're going out to work, what happens if you don't feel safe? What should you do if you're in a situation where you don't necessarily feel safe going to your job site?
Yeah, so that's a great question. So we've established a new hotline in Oakland County for any COVID-related question. And it includes, I don't feel safe at my workplace, or I don't think the pharmacy on the corner is following the correct protocols, or I'm food insecure and I'm not sure how to get food, or I haven't got my unemployment check and I'm really worried about that. So it's a hotline that covers all of those issues, and that number is 1-248-858-1000. So they can call that hotline and we can put them in touch with people that can help. So 1-248-858-1000 for any COVID-related question. But I also want to say, I'm really concerned for our businesses economically, and especially our small businesses. And I'm really proud of the fact that our county commission stepped up and immediately dedicated initially $3 million to help give small business relief so that people could keep their employees on the payroll, that they could get, they could pay their rent, they could pay their electricity bills and all of those things, because there's some really immediate problems when you run a small business. And so as you know, Vaughn, you don't have a lot of money in the bank to rely on, and you don't have a big savings account built up. So Oakland County has stepped up in a major way. And now just recently, this past week, the Board of Commissioners approved $10 million in aid that we can use, not just for our businesses, but also for health issues as well. I'm disappointed that was on partisan. That was a partisan vote, and again, it's getting more partisan now, and I'm getting worried about that. But I'm proud that the county commission gave us that ability to use those funds to help our small businesses. But there's also a number of other things that small businesses can do: small business administration loans, other things. And so our economic development folks are getting those resources out, reaching out to our businesses. I've had a number of tele-town halls with our business community to make sure that they understood what resources were out there for them. And that's going to be the next phase of what you hear us in Oakland County talking about a lot. Is we're the economic engine of Michigan. It's important that Oakland County get back on its feet quickly. And so it is a major priority of ours. And publicly, you'll start to hear us talk a lot more about what businesses can do to get back on their feet as quickly as possible, or survive until they can get back on their feet.
Yeah, as somebody that did spend a long time as a small business owner, one of the absolute hardest things is getting access to all the information that's out there about the different programs that you can apply to. Right. It really does sometimes feel like you're on your own.
And let me just add, the reason that initial $3 million was so important is because the Fed said, okay, we're going to throw all these billions of dollars at our businesses, and you're going to have access to this money. But it hasn't arrived yet, and it still hasn't arrived. So our money was really almost like a bridge grant. Okay, we know you're going to be getting some money. We know you may be eligible for some things. But hey, I gotta pay the rent on April 1st. I gotta give my employees some money. And so that $3 million, which is now totally out the door, we were able to respond more quickly and say, regardless of what money you may be eligible for eventually, we're going to get this money out the door so that you can keep the lights on for the next month until some of this federal money starts to flow.
Yeah, and I mean, one of my fun things that I get to do when I have these interviews is every once in a while I do get to put on sort of like the partisan hat and talk about why it's important to have Democrats in office. And I think this is a good example that when you're looking at a local government that is responsive in rapid terms to the needs of the residents of Oakland County, it makes a huge difference having people that understand the needs, and not from like a macro 50,000 foot level of, we're just going to throw money out the window and hope that some of it gets to people that are in need, but talking about working hand in hand with small business owners and being there and thinking about the needs of the employees. And this is a question. If I were a small business owner in Oakland County and I'm in a situation right now where, it's the middle of April and maybe I paid my bills this month, but I'm starting to try and figure out how I'm going to get it next month. Should I call that hotline, the 248-858-1000? That's something I should be looking at as well if I was a small business owner.
Absolutely, because that hotline will direct you to our economic development folks who can let you know all of the funding and resources that are available to you. And so absolutely, that hotline number will work for all of our small businesses as well.
Great. And I have one more question. This is kind of it's a little bit a couple things. So we all know that right now, landscaping is not considered an essential business. And I think for most of us, that's just practical reality. We can all mow our own lawns and trim our own hedges. But we got a couple of comments on the Facebook page from people that were worried about more like bigger scale problems. Like if I have a tree in my backyard that I'm worried about, this is real. I do have a tree in my backyard that I'm worried about falling over. But if that tree were to fall over, or if I'm worried about that, is that something that we could look for help from the county for, given that it's in that kind of gray area? It's not really landscaping. It's not like lawn maintenance, but it could be a more serious issue. And if I just leave it go and that tree does fall and cause damage to my house, now all of a sudden I'm in huge problems.
Yeah. So my understanding is that even in the governor's order of who's essential and who's not essential, there's an exception for public safety. So if you worry about the safety of your house, it's okay to address those issues. And I think sooner rather than later, we'll even get to some of those other kinds of businesses that I know she's been taking a lot of heat for. And she's really stepped into it. But I personally think that, she's listening to the science and she's trying to do the best that she can. And I think she's done a really good job. But in the example that you have given, that tree, having a regular tree trimmed right now, not essential. A tree that poses a danger and a safety issue, absolutely essential. And they should be calling whoever they can. And if they don't know of a tree trimming company that can help do that, they can use our hotline for that as well. And we'll put somebody that can help with that as well. But that's not a question. We're not trying to put people's health and wellness and safety in jeopardy. And I know that has sometimes been miscommunicated, but safety is an exception to the governor's order. Absolutely.
Yeah, and I do think too, I want to say that for all of these guidelines in the executive order, these are really, really, they're guidelines. They're things that the governor and that the state government are asking people to follow voluntarily. There's no, secret police out there checking to make sure that somebody didn't go to the store and buy video games. So
yeah. That brings up a good point. And I've said from the beginning of this, look, just because we've said this is an order, I'm not trying to fill up the jail with, people who went and tried to buy something they're not supposed to buy or cut their grass. That's not our intent. We don't have enough law enforcement in this state to be going down and giving and arresting everyone who misbehaves. That's why we really have to be in this together. It does require voluntary compliance, and that's why the politicization of this and the politicizing of this is such a concern to me. We have to step up, be mature about this, understand the science of this, and be willing to do this. And the good news is, by the way, 98% of the people in this county anyway are doing the right thing. And that includes our businesses who said, no, we get it. We're not essential. We'll hunker down and get through this together. And they've been stepping up in amazing ways and donating equipment, PPE and supplies, and helping out their neighbors and donating food and all. So even though there are examples of people who have been flouting the rules, I will tell you, I have been it's been heartwarming for me, and it's been overwhelming to see our business community step up. Just yesterday, DTE dropped off their third shipment of N95 masks to Oakland County. They're almost 100,000 masks now that they have given us. The business community, large and small, has stepped up voluntarily. Nobody made them do it. Folks that Beans and Cornbread in Southfield, I'll give them a shout out because they're helping to feed our homeless shelters in Oakland County. They didn't have to do that. They just knew that they wanted to, and it was the right thing to do. So don't, one of the things I would say to people is don't just focus on the people who are complaining right now, because 98% of the businesses and the residents of Oakland County has stepped up in an amazing way, and I'm really proud of them.
Well, there's that famous Mr. Rogers quote, which is, in any kind of emergency, look for the helpers. And there's this is a situation where being a helper is just staying home. It makes a difference. It really does. And I think, it's great to see that we are, the vast majority of people really are stepping up to try and do what they can to help.
Yeah.
So I'm going to start winding down here. I want to ask sort of my finishing question here, which is basically, is there anything that I should have asked you about that you wanted to make sure that you talked about, but I didn't mention?
Wow, that's a really good question. No, I just want to reiterate for people to be patient. And no matter where you fall on the political spectrum, I don't know any liberal that wants their liberties taken away, and I don't know any conservative that wants to put their family at risk. But as you said, and Mr. Rogers is a great role model in this time, look for the good, because there's way more good going on right now. I think there is a silver lining in that this can bring us together as a county and as a country. It used to be, if something happened in China, well, that was their problem. We understand now in a very deep and real way that we are interconnected, and that what happens to one of us happens to all of us. And if we come together and we unite together, that we can get through anything, even a really vicious virus like the coronavirus. And so, help, give your, let yourself grieve, let yourself cry, take care of yourself. If you're depressed, there's mental health services that are available. Avail yourselves of those, but understand that we're going to get through this, and we're going to get through this together. And I see it every single day. So keep the faith, stay home, practice the hygiene that you know so well, and we really will get through this. And maybe, just maybe, we'll be better off for the experience.
Well, I appreciate that. I'm hopeful that we all stay safe, stay healthy. And maybe today more than most other times I've said this, if you're watching this, and if you're still watching this, stay home, stay safe. Don't worry about landscaping. It's going to be okay. We all understand we're all going through this together. County Executive Dave Coulter, thank you so much for your time. When the Tigers do actually have a game, I'll call you.
Go Tigers. All right. Thank you for everything you're doing, Vaughn. Really appreciate it.
I thank you. No, I'm just doing the best I can. But that brings me to our closing little thing. If you're watching this still, please make sure that you have signed up for our email list at ocdp.org. Make sure that you have liked and followed our Facebook page. Make sure you're following us on Twitter. Check out our YouTube channel. We have a lot of good videos on there. Some of them are with our elected officials talking about what's going on the day that we recorded them. Some of them really more general, talking about, if you're looking at applying for unemployment, navigating through the unemployment system. How do you get help with that? Some of them are about, healthcare. If you're worried about losing your healthcare because you are laid off, how do you deal with that? So please check out our YouTube channel. And if you like any of the work that we've done, if you like any of the videos that we have put out there, if you commented on Facebook and asked a question and I answered it, or asked it to whoever we're interviewing, think about chipping in and throwing us a few dollars. $2, $3, $4 a month makes a difference. And trying to put all this stuff up on Facebook, it does cost money. And if we can get a couple extra dollars here and there, it does mean the difference between being able to reach a couple hundred people and a couple thousand people. So thanks again for watching. Thank you to Dave for coming on today. And we're starting to get more interview requests for people who want to talk to all of you. So keep your eyes open. Make sure you're following us on all the different platforms, and we'll be bringing you more content as soon as we can. Thanks, and stay safe.